Hello friends, let's today talk about dual mobility cup in hip replacement surgery. You must have heard this name, dual mobility cup, also known as DM. So let's first start with what it is. When we do a standard hip replacement, the ball that we put moves inside a single liner. So there is one plane of movement. However, when we use a dual mobility cup, there are 2 points of movement. First is between the small metal ball or the ceramic ball that we put that moves inside a larger polyethylene liner. The second is when the liner itself moves inside the cup. So there are 2 points of movement. Now, what are the advantages of having 2 points of movement? First, it greatly reduces the chances of dislocation. Dislocation is one of the most common complications that can happen during or after hip replacement surgery, and it can create a lot of mess in patient's life. So the foremost advantage of using a dual mobility cup is lower chances of dislocation. Secondly, since there are 2 planes of movement, it gives a greater range of movement. So bending, turning, sitting becomes more comfortable. It is also useful in high risk patients such as elderly patients, or where revision surgery was done, or where muscles are weak or there is some deformity. Fourth, it is more suitable for Indian lifestyle, because in India we like to sit cross-legged, use Indian type of toilet seats, or we want to sit and do activities closer to the floor. So for such situations also, this increased mobility gives us the advantage of doing all these activities. Please note that we do not recommend using or doing these activities after hip replacement, but in situations where patient is unwilling to follow this advice, or he has a profession where such things needs to be done, then dual mobility hip replacement definitely offers some advantage. Fifth is sometimes it is a very good option when we are using it for revision surgeries. That means second time surgeries or third time surgeries for hip surgeries or hip replacement surgeries where the soft tissue cover is poor. Now let's talk about the disadvantages, why it is not done so routinely or so frequently. First of all, it comes at a high cost. It is much more expensive than the normal implant. Secondly, we are still in the phase where we are studying the rate of polyethylene wear. Although modern plastics are better, the wear rate is low, but this dual mobility cup has come only recently, and literature support for its long-term polyethylene wear is still very scanty. So that is still in the process of studying. So right now we don't have any documented or long-term published data for this polyethylene wear in dual mobility cup. Thirdly, there are chances of a rare complication known as intra-prosthetic dislocation, also known as IPD, where the small ball that we put comes out of the liner. Yes, even that is possible, and that is one specific complication related to this type of design. And like I said, we do not have long-term data right now for this. We do not have 20-30 years follow-up like we have for standard implants that we are already using. So this new modality that has come into the market is looking good, is having tall promises, making tall promises, but we are not sure how it is going to turn out in long run. So in short, dual mobility cup is a good option because it reduces dislocation rates and it improves the function, especially when it comes to sitting close to the floor or sitting cross-legged. Especially in Indian context, it is very useful. Also, it is good because the bone quality, the lifestyle, everything is less hampered or less affected by this type of implant. But whenever you are going for your hip replacement surgery, it is always good you discuss all these options with your surgeon before making a choice. And in long run, I would say it is always best to leave such options for your surgeon to make choice that are best suited as per your bone stock or as your requirement. Thank you.